let's get straight down to business. Today we have a very special guest for you on this edition of the India Development Debate. He is the co-chair of the government's COVID-19 vaccine task force. He is also the principal scientific advisor to the Government of India. Our guest today is Professor K Vijay Raghavan. Professor Raghavan, thank you so much for joining us live on this edition of the India Development Debate. We've seen a whole host of announcements that have come in over the last 2 days, including guidelines for administering the vaccines. Today, at the press conference of the Health Ministry, it was announced how equipment has already been sourced and being sent to states for storage of the vaccines. These include all kinds of coolers and deep freezers. Professor Raghavan, if I could begin my interview by asking you what most of us have on our mind. COVID-19 vaccine, apna time kab aayega? When will we start seeing the COVID-19 vaccines being administered in India? How soon or how far are we from that? It's been exactly a week since the United Kingdom began the process, and yesterday, of course, the United States started.
Thank you very much. We must keep in mind that we have been very patient so far, and at the same time, vaccine rollout has been at an incredible pace. There are 3 stages in this rollout. The early stage, when supply will be modest and demand is large. The next stage, there will be enough supply to match the demand. And the third stage will be a steady state where, should the vaccine be required year after year, it can be done routinely without any problem. At the early stage, it is important that we keep in mind that vaccine rollout follows, as the Health Ministry says, 5 key strategic principles. It has to be orderly, smooth, and driven by technology. There should be no compromise of existing healthcare services. We will use the experience our country has of elections and other large-scale programs to have an immunization program. We'll ensure people's participation, and there'll be no compromise on scientific, regulatory norms, and other SOPs. So as the vaccines get through for approval, and we expect that to start happening week on week from now on, multiple vaccines, we will be also ready to vaccinate healthcare workers, about 1 crore initially, frontline workers about 2 crores, and prioritized age groups, which constitute about 27 crores. These are people above the age of 50 and persons under the age of 50 who may have comorbidities. So things are rolling out steadily. A little patient, everyone will get their turn, but we must make sure that all of this is done in an orderly way by our participation.
Of course, we must be orderly. We must also stay safe and have everything ready and prepared. But Professor Raghavan, if I could ask you, and that, pardon me for asking you in a different way, but when is the earliest you think that we can see a vaccine?
Well, we must look at that from the point of view of what the application and authorization process is. The process involves doing what are called phase 3 trials, getting the first results of those phase 3 trials, and then going to the regulator and asking for what is called early use authorization. In that context, there is the AstraZeneca Oxford vaccine, which is manufactured in India and being tested in India by the Serum Institute. There are 2 other vaccines, one from Bharat Biotech in partnership with the Indian Council for Medical Research, and the third from Zydus Cadila, which have entered phase 3 trials. These will all go with requests for authorization to the regulator, and I expect that we should hear within days for the AstraZeneca vaccine. The regulator will examine the data. That decision is up to the regulator, but those are being examined both by the UK and India, and we should hear soon. And the others will follow shortly, as the results from their trials also come out.
You're saying...
So December is a good time where we will start expecting to see these results. December or early January, it's just 15 days more for early January, so a little patience.
So just to understand the process, because you've explained it to us so well, and not all the vaccine makers are at the same stage of development. AstraZeneca, being developed by Serum, as we all know, is ahead in that sense. And from the drug regulator, within days, we will have some word on whether it's ready for a rollout.
Well, the drug regulator will ask, will either say that the approval request has been met positively, or will ask for more information. And when that more information comes, they'll take a view. So they should be allowed to take that decision calmly. Vaccines, we must remember, are given to healthy people. And therefore, the bar for safety is very, very high, as distinct from when you give a drug to someone, let's say, who is sadly terminally ill, where the risk is mitigated by the enormous benefit of saving that life.
Professor Raghavan, if I could ask you another question that a lot of us Indians have on our mind, which is that, of course, we must have an indigenous vaccine being also developed and manufactured by Indian companies and all of that. But if I look at the Pfizer vaccine, which is already being administered, whether it's in the United Kingdom, in the United States, look at the news we're getting from Canada, from Singapore, why is it taking longer in India?
Well, we must keep in mind the two or three separate factors. One, let's take the Pfizer vaccine first. It has a limited supply at this stage, and even all these countries we've talked about will get a very small set of doses, which will be modest even for them. But they are direct purchase agreements. Pfizer has also agreed to supply the global COVAX facility, of which India is a part. So once those approvals happen in India for the Pfizer vaccine after they apply, we will have a situation where the Pfizer vaccine will also be available through COVAX for India in our immunization program, should we choose to do that, given all the challenges of the greater cold chain. We must keep in mind that the Serum Institute AstraZeneca vaccine has got enormous bulk manufacturing capabilities, because our regulator took a very forward-looking step, and our government said, you can stockpile this vaccine even before the trials are over. Should the trials turn out to be positive, then we are ready with a stockpile. And should the trials fail, then unfortunately that stockpile is lost. But it's turning out that the trials are looking good, as we know. And therefore, should that vaccine be approved, we have an enormous bulk available to immediately roll out the program. So that's the difference between a vaccine which is limited supply availability and
Professor Raghavan, you know, in the detailed guidelines that have also come out, you have, of course, addressed the immediate concern, which is going to be those age 50 and above, and if you're below that, if you have comorbidities. What can it be? Can this be diabetes? Is this cancer? Is this asthma? Can you explain to us? We're going to be reconnecting with the co-chair of the COVID-19 vaccine. He's also, of course, the principal scientific advisor. He's back with us. Professor Raghavan, what I was also asking you is that when we saw the detailed guidelines, the guidelines coming out yesterday for the vaccine rollout, and as you alluded to in the start of the interview, those who work in healthcare, frontline, and aged above 50 will get priority. But those with commodities below 50 will also be in line. What is that? Is that cancer? Is that diabetes? Is that heart diseases?
The kinds of comorbidities are diabetes and cardiovascular diseases, which are widely prevalent. There could be other kinds of comorbidities, such as obesity, other illnesses which make you more vulnerable, such as lung illnesses, and so on.
So it's just good information to have on that front. Professor Raghavan, the other thing is, and the first phase is 30 crore people, right, for the vaccine administration and inoculation. How is that going to be divided among the states? How will you do it? Is it going to be as per the age population of a state? Is it according to the number of active cases, or is it, something as simple as access to logistics and how prepared they are for storage and all of that?
So there is an expert group on this headed by Dr. Vinod Paul and Mr. Rajesh Bhushan, the health secretary. And they link with the state steering committee, the state task force and the control room, and that then to the district level and to the block level. So this deep link is there. Then there's a database of healthcare workers and various people who need a vaccination from the electoral rolls. Their age is deciphered. So this combination of information from the healthcare workers and from electoral rolls will allow the data to be uploaded into something called the CoVIN software, and that's already been done, is my understanding. And this software will allow the process to be monitored and verified. So it's really a combination of our deep dive, deep connect through the healthcare and the electoral system with an IT backend, which is very robust.
What we've also seen over the last few days, in fact weeks, is the private sector wanting to also play a big role in the vaccine rollout and the inoculation process. One of the requests that has been made, for example, is can this be included in corporate social responsibility? The idea being they want their employees to be safe, for the factories to reopen, the economy to get back. Of course, everybody may want to have their own opinion on when somebody should be vaccinated or not. But is this something at all that the government could look at? Today, for example, Mukesh Ambani said he's ready to provide all the tech tools and backbone for every vaccine. And that's just he may be the biggest industrialist, but we've seen many, many large industrial houses come out with similar statements.
Absolutely. I mean, there is no doubt that while the government vaccine distribution backbone, the CoVIN IT process and the delivery system is incredibly valuable for a very large part of our country who get immunized through the immunization programs, there will be parallel efforts which will add on to this, supplement this, I should say, through private efforts in cold chain and distribution, in identification of different sets of people. And as I said, when bulk vaccines become more and more available, there will be alternates and different kinds of vaccines platforms available for those who might want to use it in a private system rather than the public distribution system. So over the next few months, I see multiple platforms and multiple tools rolling out while the government driven system will cater to the bulk of people who need the vaccines.
Mr. Raghavan, while we await the authorization process for the vaccines and the rollout and all of that, I will make this my final question. There has also been a call for many states that this should be made free. We've also seen certain countries come out with similar statements. Japan, in fact, has enacted legislation to this effect. How will pricing work in India, and then who is going to bear the cost?
Well, we must see what happens in our routine immunization program, where vaccines are provided to children in that program free. It doesn't stop others who can afford those vaccines from buying those programs, and it doesn't stop the rich from having those vaccines done at places of their choice. So this is a sort of a normal way of immunization. In this situation, when we talk about vaccines being free or not, we must ask for who. And what the government will do is it will negotiate with companies, with the Global Vaccine Alliance at rates which will be binding on manufacturers so that the government will buy at these low rates, lowered rates, and then they will decide who to give free, who to subsidize, and who to ask for payment. That would be the kind of route. And therefore, a very large part of our society who need the vaccine, the categories I mentioned, and later on others too, are likely to get this in a manner which is completely accessible.
Professor Raghavan, I would like to thank you for joining us on this edition of the India Development Debate and for being so candid. You've given us all some very good news in our fight against coronavirus, that in the days to come, we will be hearing important updates from the regulator, from the government, when it comes to the authorization applications of the vaccine makers. Can that be the way to start the new year? It will be certainly a cheerful one if we do get in a word. But like Professor Raghavan has also cautioned, we should not be rushing in.